So first off, hello. We're talking to you from the South West Regional Council, and we had an opportunity to just have a chat through what we've been doing, and we thought that would be great and hope it's of use. So I'm going to start off by introducing myself. My name is Dr. Lucy Jane Davis. I chair the South West Regional Council, and I'm going to come to introducing Abigail. So Abigail, explain who you are.
Hello, my name's Abigail Moore. I'm the BMA's Regional Coordinator for the South West, and I support the Regional Council as BMA Member of Staff from my base in Bristol.
So we work really closely together. I couldn't possibly do what I do without Abigail's support, and we cover a region that goes all the way up to Gloucester, out to Swindon, down into Dorset. Covers the Channel Islands, the Isles of Scilly, Devon, Cornwall, Somerset, Bristol, the whole works. We're a really big region, and we cover all of the members in the Southwest. In fact, all of the juniors, the medical students, the consultants, the retired members, they all fall under the Regional Council. So we are what's known as a pan-BMA group. We have a Regional Council that's made up of 23 elected members.
Plus 2 geographical members on National Council.
And we meet regularly, but one of the things that we've tried to do is, since we've reformed, we had elections last year, we're in the middle of a three-year rolling programme, and with a new council structure. And what we've tried really hard to do is engage our broader membership across the Southwest, because actually there's lots of doctors out there. And I think very much our view is about supporting our membership, but also advocating and supporting our activist doctors. So that would include anybody who is actually at an ARM, because you guys are the people who are the heart of the BMA. So my job is to help make it better. We do a whole bundle of stuff. And we can list off lots and lots of things that we do. Webinars. We've done some specific webinars about COVID. As we're a big region, we've always worked to some extent a bit virtually. But in actual fact, we've slotted into being able to do that, I think, relatively well. But what we thought we might talk about today is just a quite big project that we worked across for the beginning of this year. So we had a meeting in March of our regional council, and they identified 2 key issues that they wanted us to work on across the coming few months. So the first was to look at test, trace, isolate processes and try and bring those to being robust and locally based. So that's an ongoing piece of work. But the second one was looking very much at the risks associated with tourism during a pandemic. Obviously, almost all areas of the UK have nice tourist areas, but Devon and Cornwall in particular, we were very aware that we would have an influx of people coming down because, if people were less able to travel internationally, then it's a lovely place for a holiday. So we talked to national BMA, but we also engaged our regional stakeholders. So we talked to the LMCs, the CCGs. We approached public health, both Public Health England, but also the different public health local authority settings. And we got a sort of a package of 12 key issues that people were concerned about, and boiled that down into a public-facing campaign. This was part of that, and this was the sort of snappy version that could go on Twitter. If you're interested to find the bigger version and also the guidance that was written, so there's a document called Tourism in the Time of COVID, and it's an outline of the issues and basic principles, which is hosted on the BMA website. But there's also a larger poster version of this set of infographics, which you'll be able to find on the BMA website as well. So basically, it's a run through of the things that you'd hope people would think about before they go on holiday, and it's simple advice. But the idea was to try and help people to plan for a holiday. So this one was very much about before you go away. So it's trying to make sure that you've got your medicines. And it's public facing, but actually it's driven by doctors on the ground, because this was the stuff that, we in holiday areas, again and again see people who come on holiday and they haven't packed their prescription medicines, or they've forgotten their repeat medicines. So it's about trying to help people think about that. Now, those issues have changed slightly with the way that GP is being practiced now. People should be able to access their GP remotely, and they should be able to get a remote script done. But still, trying to help proactively was what our members wanted to happen, and I think it's been probably very helpful. The next slide, the next infographic. So this was very much about the principles of social distancing and all the things that sit around that. And we kept it quite general because things like face, mask wearing, we knew that when this was worked on, actually it would potentially change over time, and it did, but this is general enough that it would cover the things that we were concerned about. The other thing that we put in was about trying to reduce the number of times that you had to go into, for instance, the supermarket, because it has an impact on the local population. But you'll see that actually a lot of what we're talking about here is not specific to Devon and Cornwall, for instance, but would be it's nationally of relevance, because everywhere has tourist spots. The final slide, the final infographic, was about some of the things that might be an issue while you're away. One of the things that we have seen in Devon and Cornwall is actually the emergency services and GP out of hours have been really enormously stretched. We've had both the lifeguards reporting some of the highest numbers of the RNLI, highest numbers of needing to step in to save people at sea. But also we've seen situations where the ambulances and the fire crews are under enormous stress because the call-outs this year have been incredibly high. So trying to be proactive about flagging that, we knew it was probably going to be an issue, and it sadly has been. So it's encouraging people to think about things like that, and then making sure that people could be followed by test and trace, which I think is going to be an ongoing issue as we go into the autumn. We got massive, both regional and national media interest, and actually I have to say, working with the BMA centrally, they helped to promote this as a positive message. We were covered in several of the broadsheets and almost all of the tabloids in terms of trying to raise the profile on this, and it was a really positive message. It was, what can you do to try and make things safer? Not don't come on holiday, because that wasn't what we wanted to say. What we also did was we worked really hard to make sure that we worked with the LMCs, and I think I read out to the national LMCs and also the CCGs. And what we did was, from a very early point, I think I mentioned earlier, we worked with MPs across the region. As you can imagine, there was a very varied response from our MPs. I wrote to all of them early on in, was it March or April? I can't remember, Abigail.
April, I think.
So we wrote to all of them, and then we coordinated getting all of our members who were interested to write to their constituency MP to raise the profile as well. And we've started a process whereby we will hopefully build on that and get people to write to their constituency MP. That's something I think we're very keen to keep going. But it can be a really powerful thing to do, but it needs to be done in a coordinated way, I think. And we basically went out and talked to anybody that we thought was of relevance. So we talked to quite a lot of the tourist boards. We talked to chambers of commerce. We talked to all sorts of people. And in actual fact, we managed to get this on the agenda way ahead of anybody else. And I think we really were ahead of the game on this. The other thing that Abigail reminded me of is actually Devon and Cornwall Police shared this with their officers and in their stations. And being able to be a voice of the BMA, I think, is incredibly powerful. And it's also incredibly important for our membership, because actually what we're trying to do is reduce the risk that the public are putting themselves at, and thereby reduce, hopefully, the workload that our doctors are having to cope with across the Southwest, and in fact, probably across the country. I'm trying to think if there's anything I've missed, Abigail.
I don't think so. For me, it's an example of something that we've done, a campaign led by that came out of the work in the region. And I think that enhances the campaigning work that the BMA does overall. And so in that sense, it's a good example of where regional councils add some value.
Yeah, I think so. And I think it's about thinking strategically about how you can impact on things, because actually I think it's hard sometimes to envisage how you can change something, but actually what we were empowered to do was be able to have those conversations and raise things as an issue which we thought were important, and I think that's something that we need to continue to build on. So I would say that anybody listening to this who's interested in getting involved, do get in touch. We'd love to hear from you. And although we have obviously an elected council, I'm very keen to develop a support network of all the other people in the region who are keen to get involved with stuff, because actually there is always stuff to do and we want to hear your voice.